Heart disease causes 1 in 4 deaths in America each year. That's about 647,000 people. It's the leading cause of death for both men and women. The scary thing is, many people don't even realize they are developing heart disease. The disease progresses silently over many years, and the first heart attack is often fatal. But here's the good news. There are subtle early signs that can indicate you may be on the path toward a heart condition. Being aware of these early warning signs and taking action can prevent a heart attack or stroke down the road. In this video, I'll walk through 15 early signs that may mean you're developing a heart problem even before major symptoms like chest pain arise. Some of these clues may surprise you because they don't seem connected to the heart at first. Things like pain in the jaw or snoring at night could be early whispers of brewing cardiovascular trouble ahead. I want you to tune in and learn these not-so-obvious early tip-offs because catching them early literally can save your life. Taking steps to protect your heart health at the first subtle signs allows doctors to check what's going on. Then they can prescribe medication, stents, or lifestyle changes to turn things around before you have a catastrophic event. Here are 15 early warning signs that may indicate emerging heart issues before it becomes a life or death emergency down the road. 1. Tiring quickly or shortness of breath. If you find even simple physical activities like climbing stairs, lifting packages, or walking a block causes you to be winded or fatigued easily, pay attention. Emerging blockages in heart arteries reduce blood flow and oxygen delivered to muscles early on, leaving you feeling exhausted by minimal exertion. Don't blame it on being out of shape or poor sleep. See your doctor for a heart health evaluation if you're tiring quicker than is normal for your fitness level. Catching reduced cardiac stamina early allows for corrective treatment to improve energy and prevent a cardiac disaster down the road. 2. Swollen ankles or feet. Fluid collecting in the legs or puffy shoes at day's end can indicate damaged heart valves or weakened heart muscles starting to develop. Extra fluid leaks into nearby tissues causing swelling, which gets worse by gravity's pull when standing or sitting too long. Taking off your shoes and propping up your feet helps reduce ankle swelling, but frequent edema should be medically evaluated. It can reflect early-stage heart failure or clogged arteries impairing normal fluid circulation. Identifying why fluid is backing up allows for better treatment sooner rather than later. 3. Irregular heartbeat. Notice if your heartbeat feels erratic, rapid, pounding, or fluttering inconsistently, especially if it comes and goes. Brief palpitations when excited or exercising are often harmless. However, frequent heart rhythm disturbances, also called arrhythmias, can reflect damaged cardiac electrical pathways brewing, which can progress to even more irregular patterns over time. Arrhythmias originating from emerging heart disease raise clot and stroke risk. Getting an early handle on rhythm disturbances can stabilize the electrical system to avoid escalation through treatments like ablation, medications, or pacemakers in less severe cases. 4. Indigestion or nausea. Don't assume chronic tummy troubles are just from your diet choices or stress alone. Frequent heartburn, acid reflux, nausea sensations, cramping, or upper abdominal discomfort can reflect concealed artery plaque buildup impairing blood delivery to your heart nearby. This gets misinterpreted sometimes as only digestion complaints rather than limited blood supply affecting heart muscle cells first. Especially if GI symptoms seem treatment-resistant or keep recurring, check in with your doctor about evaluating your heart health to rule out connections from inadequate coronary circulation in that region. 5. Jaw pain. Aching or pain that radiates up from the jaw, down the arms, between shoulder blades or neck discomfort, especially on left side, can arise from brewing cardiovascular disease rather than just standard muscle tension. Nerves stimulated by developing heart vessel plaque misinterpret and transmit these signals as facial or upper body pain instead of classic, crushing mid-chest discomfort that men usually describe from heart attacks. These atypical symptoms tend to occur more commonly among women as emerging signs in the months or years before major cardiac events happen. Pay more attention if pain comes frequently and persists for no clear reason warranting medical clarification. 6. Extreme fatigue exhaustion. Extreme fatigue exhaustion goes beyond normal tiredness from working too much or occasional insomnia. With emerging blockages slowly reducing oxygen to cells, fatigue can become relentless, severely limit activity tolerance, and just keeps worsening progressively over weeks or months despite adequate rest. This unexplained, prolonged weakness warrants further heart health tests like a stress test, especially if combined with other whisper signs like shortness of breath or dizzy spells upon standing too fast. Catching stealthy coronary artery disease in earlier stages while still readily treatable reverses fatigue to restore normal energy long before muscle damage becomes permanent. 7. Snoring or sleep apnea. Snoring or sleep apnea. Increasingly loud, frequent snoring, especially when both inhaling and exhaling or observed pauses in breathing during slumber, point to obstructive sleep apnea. This reduction in oxygen while sleeping strains the heart without your awareness as it struggles to keep pumping adequately overnight. Like an unwanted stress test every night, sleep apnea progresses underlying blood vessel disease faster. Getting checked for this breathing disorder allows treating it before lasting cardiac capacity declines or even sudden death occurs in severe cases. 8. Feeling faint or dizzy. If you suddenly feel faint when standing too fast or walking and need to steady or sit yourself, but it passes in less than a minute, usually it's harmless. However, progressive dizziness, lightheadedness, or actually passing out signal potentially dangerous heart rhythms erupting or heart failure limiting oxygen to your brain. Dismissing occasional dizzy spells as no big deal delays getting to root causes like uncontrolled high blood pressure, damaging delicate vessels plus the electrical conduction system, initiating erratic heartbeats leading to unconsciousness. Revealing such episodic weaknesses to your doctor promptly helps detect and stabilize brewing issues before worse harm comes. 9. Numbness in feet or leg discomfort. A blood flow blockage affecting arteries supplying lower limbs can present with symptoms like claudication, discomfort, cramps, numbness or fatigue in calf muscles, thighs or buttocks arising while active but disappears upon resting momentarily. Poor circulation progresses stealthily as plaque accumulation slowly narrows vessels feeding oxygen-depleted muscles. If leg pain consistently hits at predictable levels of exertion, circulatory limitation likely explains the limping origin, rather than orthopedic joint, knee, or back problems alone, although combined causes happen too. Identifying rising peripheral vascular disease early helps prevent limb threat downstream or further circulatory impairment effects elsewhere over time. 10. Erectile dysfunction. Inconsistent erectile rigidity or weak intermittent erections can be your very private early warning sign of widespread vascular disease. When plaque accumulates, slowly limiting blood flow over years, small penile arteries seem first and most functionally affected. Bypassing embarrassment to address new-onset erectile impairment issues promptly helps accurately identify silent arterial disease progression while still readily treatable through lifestyle and medications, protecting your heart and virility together long-term. 11. Memory lapses or foggy thinking. Normal aging contributes some mild forgetfulness as the decades roll by. However, your brain depends on 20% of blood circulation oxygen delivery pumping constantly to nourish optimal cognitive function. Early-stage vessel narrowing and diminished blood flow adversely affects more vulnerable brain cell networks first. Early warning signs like progressive difficulty remembering common details, word-finding challenges, mental fatigue, and cloudy, unfocused thinking warrant evaluation for underlying cardiovascular disease origins. Catching stealthy circulation issues soon enough prevents them cascading into permanent dementia decline over time. 12. Skin changes. Healthy, supple skin tone results from ample oxygen-rich, blood-nourishing skin cell turnover continuously. But emerging peripheral vascular deficiencies present with thinner, shiny, purplish skin lacking normal elasticity, which breaks down faster while healing poorly, especially on distal digits and legs first. Symptoms can progress bloodlessly from dry, itchy legs to slow-healing injuries, ultimately resulting in ulcerations inviting infection without intervention. Getting proactive circulation evaluation aims to reverse worrisome skin signs before permanent tissue loss threats develop. 13. Changes in vision. The optic nerve serving exquisite eye anatomy remains highly sensitive to even mild oxygen fluctuations from perturbed blood flow. Early on, emerging vascular disease can present with intermittent blurry vision or seeing unexplained fleeting lights, floaters, or dots in the visual field. But left unaddressed, progressively reduced circulation damages delicate retinal tissues, resulting in permanent blindness over time. Experiencing novel visual disturbances warrants urgent clarification for root causes, especially if other whisper signs accompany them. Rather than dismissing fleeting symptoms until 20/20ths, vision remains permanently lost. Catching early changes promptly aims to rescue oxygen-dependent eye health. 14. Persistent coughing. Coughing signals respiratory defenses addressing detected irritants, but sustained chronic coughing without identifiable lung disease, especially just at night, while recumbent hints at early-stage heart failure. Accumulating coronary artery plaque slowly hijacks pumping capacity, eventually backing up fluid into delicate adjacent lung tissues. This manifests as hacking cough when lying down initially, but progresses to orthopnea and even cyanotic skin if untreated long-term. Breakthrough night coughing or needing extra pillows to breathe easier warrants evaluation for occult congestive heart disease if no other lung pathology explains chronic cough causes. 15. Chronic kidney disease. Kidneys act like a filtering plant, extracting body waste from circulating blood, requiring tremendous consistent blood flow delivery. In early stages of atherosclerotic disease burden, delicate kidney structures suffer some of the first damages from erratic circulation before other downstream organs display overt symptoms. Increased creatinine levels on routine blood work can indicate impaired kidney filtration capacity before you even feel ill. Getting worked up for why kidney function appears worsening protects from needing lifelong dialysis if vessels narrowing cause progressive kidney failure unaddressed. Catching early kidney disarray helps stabilize plaqued vessels through medication and lifestyle adjustments, preventing permanent renal shutdown long-term. As you just learned, early heart disease onset has many subtle signs beyond just that classic chest clutch movie heart attack scene. Gradual impaired blood circulation affects vital organs like the brain, eyes, kidneys, plus skin, years before catastrophically killing heart muscle we depend on to live. Recognizing early symptom subtleties provides a long lead time still to intervene, preventing permanent disabilities if caught soon enough. I hope reviewing these 15 early tip-offs heightened your awareness for changes to get checked out sooner rather than later. Screening tests like cardiac calcium CT scans, CIMT ultrasound carotid vessel studies, exercise stress evaluations, and advanced lipid profiles help define disease likelihood years before catastrophe strikes if concerning symptoms arise. I hope you found this overview on the subtle early signs of emerging heart disease useful. Recognizing your body's clues early allows taking steps to prevent catastrophe down the road. Partner with your doctor. Sorting symptoms. Early detection is key. If you enjoyed this video, hit subscribe and click the notification bell so you don't miss any future posts. Thanks for watching, and we'll see you in the next video.